So first, I'd like to say, Professor Kapoor, thank you for the introduction, because your introduction and context setting also set the context for the formation of this team and some of the service that I'll be describing here. Because this team was set up in response to the long-term plan, to the community mental health frameworks, and to looking at the transformation of services for people with personality disorder complex needs. I also want to just give a nod and a thank you to my colleagues whose names are there who actually developed these slides. So thanks very much. Do you want to, next slide, Bradley? Okay, so the personality disorder and complex needs team, as I say, was developed as part of the transformation project in EPUT. This, of course, is going along with all national agendas, integrating primary care, secondary care, and working to have better integration and communication across services in secondary level mental health, including our CMHT colleagues and psychological services provision. So the team consists of, we're a multidisciplinary team, psychotherapist, myself, we have a clinical psychologist who also, two clinical psychologists leading on the transformation, assistant psychologists, specialist psychotherapists for transition from our CAMS to adult services, a point of transition that we know can be difficult. We have a systemic family therapist, a psychosocial nurse specialist, and social worker. Bryony's on the call today. She's our service user network, and that's been a substantially new development that's really valued throughout the system. We offer direct clinical interventions. We see it mostly as we work alongside colleagues who are working with complex clients who are presenting with multiple need. So we have direct clinical roles, we have provision of consultation, we offer support to colleagues, we offer a lot of training. We have a various program of training. We have a one-day training for PD awareness that's getting good results and favorable reviews from our colleagues. We've rolled that out across the entire system, and that's supporting understanding working with clients with personality disorders. Our focus is supporting systems. It's working across all the systems and working to integrate at various points where there could be ruptures in systems. Next slide, please, Bradley. Okay. The service user network and the personality disorder complex needs service. Sorry, I'm misunderstanding how to read that. Let me just start again. So we provide the personality disorder awareness training, which I've just mentioned. We provide the service user network, and they provide awareness groups and support groups. And they're also very much part of supporting our service users in co-production across a range of activities in the trust. And that's been highly valued. I just did a training the other day with a service user, very welcome interventions he can offer into that training. The specialist multidisciplinary team, we invite colleagues into the team meeting. We're trying to link up with colleagues across the network that often have found themselves feeling like they're working in isolation. So we've brought in colleagues from drug and alcohol services, from other teams, from crisis services, and just to start making those links and understanding where we can start joining up and working together. The forum that is particularly being mentioned in these slides takes place in the southeast of our trust. The multi-agency complex needs forums have been developed to reach out across all agencies, all providers and stakeholders in client care. So we invite colleagues from primary care, from secondary care, but we invite colleagues from the volunteer sector, from housing, police, ambulance services, FI, and invite that range of participants to come and discuss the care that is needed for that client to actually then identify steps forward and to have a responsibility for supporting those colleagues in taking those next steps forward. It's the first time we've been able to have a forum to integrate care across such a wide spectrum of need for our clients. And some of our commissioners in the Southeast who've attended this have gone as far to say they think these forums will save lives. So while we're not dealing specifically with self-harm and suicide, I'm hoping that the overview of the reach we're trying to have with these forums gives an indication of the complexity of what we're working with and trying to support that we're not getting to those areas. In these forums, we have case consultation. We can offer a formulation, or we can support our colleagues in developing the formulation. We use the biopsychosocial model, of course, and we're working alongside our psychology colleagues in developing that. The other thing that's not mentioned here, but we're also on the cusp of rolling out training across the entire trust for structured clinical management. And then we'll be using those formulations across the trust, including safety planning. These forums also provide a space for reflective practice and for supervision. And having identified that in these forums, we then can take it forward and offer that across the services. We offer other one-to-one interventions as well. Next slide, please. Our goal is to actually make all our services more efficient. We want to make transitions for our clients as convenient as possible. We want to make communications with our colleagues as convenient as possible. We want to coordinate care within local systems and explore access and smooth transitions between services. Our aim is to actually work with each of the localities. So we want to work with what is in place and support the relationships that are in place. So if a client has a care coordinator, for example, we want to work alongside that team, that system, and support them in their work. The idea of coming together in the multi-agency forum, more heads, more options, more thinking about care. And we've had some really interesting clinical discussions in these forums. We create a network that's more convenient for communication, that's Essex-wide, and we borrow from each other's ideas because each of the localities does have different ways of working. Also, just to step back, the trust was created out of two separate trusts. So there are different cultures and there are different practices. So we're constantly trying to learn from each other. We offer peer support. And kind of mentioning that throughout, that we're trying to work as a team, working with the local teams and to ensure the effective management of risk. Often colleagues will come to us when a client is presenting with significant risk or the presentation is very complex and they need the additional support. Maybe a care coordinator needs some more psychological support in thinking about their work, and we'll work alongside that care coordinator. Next slide, please. No wrong answers, only intuition. Within the multi-agency forum, we encourage a no hierarchical approach. It's an egalitarian attitude that everyone has equal input, and we're trying to provide a space where professionals are able to speak freely, and we should be run by ideas. Sorry, I can't see the rest of the quote. These discussions are really rich. They're multidisciplinary spaces. We bring in a lot of experience, a lot of expertise, and a lot of knowledge about a particular client that we're talking about. So there's often a rich clinical discussion, a sharing of ideas, and then we come to, okay, what are our next steps? How do we actually support the case management, if you like? Next slide, please. So how it works. This is just more specifics. So anyone in the system who feels they would benefit from the multi-agency discussion of a client can contact us. We work with that person in identifying who they feel would be necessary to bring into that discussion. We support inviting them all in. We arrange the appointments, the invitation, all the paperwork necessary, and then we bring them into this discussion. And as I've just said, following a clinical thinking, clinical discussion, we agree actions and we allocate how those actions are going to be taken forward. And many of our colleagues have said, I'd like to book another appointment in so many weeks' time. I'd like a follow-up. I'd like support in continuing this. And we absolutely welcome that. Next slide. So those are just some access points when we deliver this to our local colleagues.